So the psychiatric eval is 1 hour appointment. This is where we talk about signs and symptoms, past treatment responses, medical history. Always ask for head injury. And even if the patient tells you no, because I had the same situation happening yesterday, I was like, have you had any trauma, accidents, so forth? And then even with that, they said no. And then I asked them, have you had injury? Oh yeah, I've had concussions and, and I'm like, okay. So always ask for that. Even infections causes a lot of inflammation. COVID is bad, right? Other than people complaining they can't smell, they can't think, they have foggy brain. What I found out, or what if researchers found out, is because it causes inflammation in your blood vessels in the brain. So we have to focus on getting the brain healthy. But we got to elicit all these things. What is causing a patient to have an unhealthy brain? And along with medical, of course, we have to ask, history of abuse. Sometimes they won't always tell you. Yesterday too, I asked the patient, have you ever gone through any trauma? No. Wife says, yeah, he had a gun pointed at him 3 times by the police. That's pretty traumatic. It jars you, right? You may not have thought about it, like it didn't, but all that increases your fight or flight. So, as well as relationships, are they toxic? Are they helpful? And we have to ask about substance abuse. Why? Because that is toxic to the brain. It is not as healthy as some people think. I was at a substance abuse conference that basically said the most infamous plant that everybody thinks is great for them, right? He said they're not, they're the enemy. So we need to ask these things about substance abuse.